to the practitioner track. Today's speaker, Elaine Deschamps, has worked 27 years for the state of Washington, including 8 years as the director of the Washington State Caseload Forecasting Council. This is an independent state agency responsible for producing the entitlement forecast for the state budget. She was a double major in political science and economics at the University of Puget Sound, received her PhD in political science at Indiana University. Elaine is published in IJF and in Foresight, and she is Foresight's editor for government and public policy. She's also a director on the IIF board. Elaine's interests involve organizational dynamics forecasting, health care and budget forecasting, sea kayaking, and creative writing. Elaine, thank you. Welcome.
Thank you, everyone, for being here. I know there's no mic here, so I will try to talk loud. I'm usually pretty good about talking loud. So again, thanks for being here. We're going to be talking about how our state agency managed navigating through the COVID-19 pandemic. And when I got up this morning, I was like, I forgot to put jewelry on. I'm like, oh, no, wait a minute. I have one necklace. And I thought, this is the perfect necklace for where we're at today. And what it is it's a necklace my mother gave me, and it says Sisu, and she's Finnish, and the word Sisu has no English translation. What it means is persistence and resilience and fortitude despite all obstacles. And I think that's what we've gone through, not just as forecasters, but as human beings. So what I'm hoping is that today that we do have time for interaction. I don't want to just sit here and tell you my story. I want to hear your story. I want to know, what was it like forecasting during COVID? Public sector, private sector, we all went through very similar struggles and triumphs. So what I'm going to talk about today is collaborative forecasting in Washington State budgeting. And for those of you who want equations, you're not going to get any today. So if you want equations, you're in the wrong place. If you want to break from equations, you're in the right place. If you want to talk about politics and organizations and mitigating biases, then you're in the right place. And but before I get into how we managed COVID, I need to give you the context of the Caseload Forecast Council and our, and then I will go into the ABCs of forecasting in organizations. And what that gets back to is back in 2005, I wrote an article for Foresight. It was the second edition, I believe. And I took the 8 years of experience I had at the Caseload Forecast Council. And I said, what lessons have we learned? And so I came up with the ABCs, and then I actually had a D and an E and an F, but that's for a later talk. So then I thought, well, what does it look like now? How can I apply those ABCs from 2005 to how we managed the pandemic? So that's what we're going to talk about. And then, of course, we'll get to lessons learned and next steps, and time permitting, I really hope you'll reach out and share your experiences. So just like in a Foresight article, we start with our key points. The first 3 slides are going to be just the 10,000-foot level, and then I'll provide the context. The COVID-19 pandemic, of course, tested the limits of statistical models and heightened the importance of judgment and domain knowledge in our forecast budget process, not just public sector, the private sector, and so I think we have a lot to relate to, regardless of what perspective we're coming from as forecasters. So key to weathering our perfect storm was collaboration through a technical work group process. Unfortunately, at the CFC, we now have 25 years. It's our 25-year anniversary as a new agency in state government. So we have this foundation of a technical work group process where we bring in program area experts and meet regularly with budget and forecast analysts to review assumptions and ultimately strive for transparency and consensus. So I'll be, again, revisiting those ABCs of forecasting in organizations: acceptability, bias identification, collaboration, and communication. And how do those ABCs shed new light given the experience we've gone through with the pandemic? So again, 10,000 feet before you get the context. So back in 2005, the lessons I learned from working as a forecaster at the CFC was it's not just about accuracy, it's about acceptability. You can have the most technically sound forecast but it will go nowhere if it's not accepted by those in power, whether they be politicians, managers, CEOs, CFOs, anyone with ultimate decision-making power needs to buy off on the forecast. And to buy off on the forecast, you need to trust it. And to trust it, you need to understand it. So that's a key lesson learned. Bias identification. So we all have potential conflicting interests and motivations, and they can interfere with forecast accuracy and acceptability. So let's get those biases on the table. So for those of you in the private sector, you're talking about sales and marketing, finance, various silos in your organization, and how do they reconcile their conflicting interests around the forecast. For state government, a similar situation is that we have agencies who might want a higher forecast, and maybe the governor's office or the legislature might want a little bit lower forecast. So you have these conflicting interests potentially. How do you manage those, and how do you ultimately arrive at a consensus forecast? Collaboration and communication, that's how we get there. So this is the key to establishing trust, demystifying the forecast, incorporating structured judgment, and achieving consensus. So that was back in 2005. 2023, I have a forthcoming article in Foresight. We're bringing up those ABCs again. What does it look like now? How do we communicate the risk assumptions to decision makers during times of great uncertainty? We're in the most uncertain time, of course, I've ever had in 27 years of doing forecasting. In a simple matter, despite the complexity. We know, as Da Vinci said, simplicity is the ultimate sophistication. How do we do this? When we have so many things up in the air that we're trying to forecast, it's so complicated. How do we still arrive at a forecast that decision makers will understand and accept? Bias identification. We have a little bit of hindsight now, coming out of the pandemic, that there was a unintended optimism bias. We kept thinking we would return to a new normal. And then that became the new normal. And then that became the new normal. So we're recognizing that optimism bias, and you'll see some details of that shortly. So again, collaboration and communication take even more importance when your statistical models either fail or compromise because you lack the relevant historical data. So we're going to talk about that, how that technical work group process that we have allows for the collaboration and communication that helped us sort of weather this storm of the pandemic. And I'm going to talk a little bit about impacts of remote workplace on the forecast process, which I think everyone here, I assume, can probably relate to in some regard. What did it look like to go from your office to go home and produce your forecast and still collaborate as a team? Okay, so now let's get into the nitty-gritty about the Caseload Forecast Council to provide you with the context so then we can start talking about how we weathered the storm. So we're a nonpartisan independent agency, and we basically produce the demand side of the budget equation. I think most people are probably more familiar with most states have an agency that projects revenues and the economic scenario. We are the demand side, and they're the supply side. So we produce the caseloads that make the baseline of the state budget. They're primarily entitlement programs covering public education, corrections, public assistance, children's services, medical assistance or Medicaid, long-term care. And so we're basically the baseline, and our goal is to keep the politics out of that baseline. Let the political decision makers worry about, say, the other 20%. Like, this is roughly 80% of the budget, more or less. Let the decision makers worry about the 20%. Again, so we were created 25 years ago to promote transparency, acceptance, neutrality, and collaboration. And so they are the official forecasts, and that's in our statute. Again, I mentioned the foundation of the state budget. They're required to be used by the governor and the legislature, and they are reviewed through a rigorous and collaborative technical work group process. So a little bit more about our process. It's a 3-step one. We start with the nuts and bolts of the process, which is our technical work group. And we cover a lot of program areas, as you've seen before. I just listed off like 6 major program areas, but there are sub-programs within those. So we actually have 12 separate work groups by program area. And this is really the core of the nuts and bolts of how we do our forecasting, which I'll talk to in more detail in a bit. The next layer of our process is called the formal work group. What this is is you've got at the technical work group level, you're bringing in agency program experts with legislative and executive budget analysts, and the CFC staff forecasters are the ones that facilitate these work groups. At the formal work group level, you have typically the people that might be the bosses or the next layer up from the folks on the technical work group. And they are sort of the intermediary between the technical work group and the Caseload Forecast Council. So ultimately, our forecasts become official by being presented to a bipartisan council of 4 legislators and 2 executive appointees. And those 4 legislators are equally distributed between Republican and Democrat House and Senate. So this is sort of a way that we can look at the big picture at this level before we go to the council, at least the formal work group. Yeah, that's where we go to the council. And we get the forecasts are reviewed and approved 3 times a year for the governor's budget in November and for the legislative budget in February. And then the spring outlook in June, which we just finished. We just wrapped up our forecast, that's why we can be here today, is really a spring outlook to the next biennium. And it's also a time for us to add policy changes into our forecast. So the legislature convenes and they pass the budget and they pass a bunch of bills, and then we take that information and we incorporate that into our forecast. And this, if I think analogous to the private sector work, I kind of think of it as we just get a bunch of new product forecasts, right? Because there's usually like a new policy, we typically don't have some prior history about that policy. But that gives you a sense of what an analogous situation would be like in the private sector. So I've talked a little bit about the technical work group process, but I just want to emphasize that this group of numbers nerds, if you will, we have a safe environment to incorporate expert judgment and domain knowledge in an environment that fosters trust and respect. We're bringing in the agency people who have the field knowledge of what's going on. We also have the agency budget folks who know what's going on in the big budget realm. So this is a way that we bring in judgment and domain knowledge in a place where people feel comfortable discussing. And again, part of that is because they feel comfortable setting politics aside. We review major assumptions affecting the forecast, such as the baseline trend and step adjustment, which I'll talk about pretty soon. And again, the step adjustments are what we call those policy changes that I just mentioned. So the goal of the technical work group is to ultimately get consensus, get an official forecast, demystify the forecast so it's understandable and acceptable, and ultimately reduce bias. And this is just a little bit of background. Again, a unique situation of the forecaster's job, which I will mention that my team is right over here. So if you have any questions, so our group of forecasters are here with us today, and I'm super excited about that. But the forecaster's job at the CFC is really unique in that they do the data extraction, cleaning, and dissemination, and then they do the forecast production, and then they get feedback through the work group process as well. But then they're facilitating the technical work group. And I think for folks who are typically, data-driven forecasters, it's not necessarily an easy thing to jump over and then facilitate, a room of people who might be, have pretty strong opinions and sort of navigating a room and making sure that you're, getting the voices of people who might be quiet, and you're also sort of managing people who might be sort of sucking all the oxygen out of the room, if you will. So it's a really unique job. So to our methods. So the baseline trend is absent policy changes. We're doing the best we can to remove anything but your just basic baseline. And the way we do that is through time series models, entry-exit transfer models, and some regressions using independent variables. And it really depends on the area that we're forecasting and the data that's available. Our data comes from state administrative data. Most of it is on a monthly basis, not all, but most. So that's our baseline trend. And then we do a step adjustment. Again, like I mentioned, that's the impact of the policy change. And I will note that we do have a long forecast horizon. We're forecasting biennias, right? So our forecast can go up to 36 months in advance, depending on the forecast cycle that we're working through. So this is sort of a big picture. This goes back to my dissertation back in 2003. But in the big picture, what did we do in Washington State? We created a back then a brand new organization, now 25 years old. So we created an independent forecasting institution. We created this collaborative process, and it improved both forecast process and forecast product. So you've seen this slide before, but I figured now that you've got a little more context, there's your ABCs again. The most statistically sound forecast goes nowhere if not accepted by those in power. Bias identification, bring those conflicting interests and motivations, bring them to the table and just make sure they don't dominate the discussion, and do our best to mitigate those. And then the importance of collaboration and communication to incorporate structured judgment and achieve consensus. So I just want to take a little break to ask if anyone has questions before I move on to talking about how we dealt with the COVID pandemic. Stefan?
All right, so thank you very much. That sounds very good and very, very interesting. My question would be, has this setup been copied by other states in the US, or did you copy from anybody else, or?
Yeah, so that's a great question. Our statute was built off of our Economic and Revenue Forecast Council. So our demand side statute was built off of the statute of the supply side organization, our sister agency. We did some consulting with Massachusetts, and I have to check to see where they're at with things, but they tried to create a new agency, but they barely funded one person. So I'm not sure where they're at, but they did try to, they brought us in as consultants and then tried to model that. And I don't know if you folks know of any. Yeah, I've reached out and asked, and I don't know of another agency that's out there.
Yeah, and I've gone to conferences of legislative analysts, budget analysts, and many states, it's purely political, how they predict future caseloads or costs of their programs.
Right.
Yeah.
I want to ask, can you give an example where the accuracy and the acceptability, you'd had to work with that?
Oh, I have an example from a long time ago. I wish I could mentally bring back the slide. It was with nursing homes, which is an example I'm going to be using. And the forecast that I think the legislature wanted was it was just the forecast. The actuals were going down, and the agency wanted a higher forecast. And I came up with a forecast that I had a gut feeling, what I ended up doing is compromising a little bit on what I thought the right forecast was, but just a little bit, because the divergence from what the agency wanted and what the legislature wanted was so vast. And then I did track, I'm trying to remember, but there are examples like that where you don't know at the time whether or not you're sacrificing accuracy. You just think that you might be sacrificing a little bit of the technically sound forecast at the risk of, or at the benefit of getting acceptability. So that's a slide I'll have to dig up again and share. That's a good question. Thank you. Yes?
Can you talk a little bit more about the second step you just said, the policy change adjustment after the first step model?
Yeah, you bet. Yeah, so the way it works is that during legislative session, when a bill is put forth, usually what's called a fiscal note is requested of the agency, and they give their best guess at what that impact of the policy is going to be. And so then, once the bill passes, our forecasters work with the technical work group, and we review the assumptions behind the fiscal note. And if we have additional data since that fiscal note was produced, then we update it. But usually we default to that fiscal note because we know that a lot of work and effort went into the agency's best guess at the impact of either a cost or a savings of a bill. Does that address your question, or?
Oh, I see. So it's more like something like expert opinion, something like that.
Yeah.
So sometimes it's usually it's mostly data driven, but Webb, did you want to say?
Well, I was going to say, for example, we do TANF, and the agency, if they have a piece of legislation that looks like it'll go forward, they'll have a pretty data-driven, like you're saying, model of its effect on the TANF caseload. So it'll be maybe 100, say often it's 100 or so people per month will be added or subtracted because of some policy change. And they'll model that out through the whole biennium as part of the fiscal note process. Then I'll get those spreadsheets as my starting point to to incorporating that as a step into the forecast.
It's a little bit like a new product introduction, and in that
I
sense,
think that's a
when the
great
entitlement
analogy.
eligibility changes, your historical data are no longer as relevant to your forecast because they're all from the previous eligibility regime. And this is actually, I think, kind of an area where frequently we encounter some of that acceptability issue, because having just gone through a legislative session with a lot of political investment from all the parties involved, there's a lot of attention on those adjustments, whether they're relatively large for the program or relatively small. But there's an expectation to see those things reflected in the forecast. And even if maybe having one of these step adjustments in some particular cases may have no benefit. It may just be too small and it may be more problematic than helpful.
And like a new product, probably in many organizations, you look at what data you have, but when they change the eligibility, you try your best based on whatever historic precedent you have, and then you quantify those assumptions, but only time tells if it.
Yeah, and we do, and I will talk about our annual performance measures as well. Oh, Stefan. Yeah.
Just one more comment on your acceptability dimension, essentially. And you were talking about legislators and managers and all these bigwigs and CEOs, and sounds very interesting, yes. And where I'm coming from, it's people far farther down the totem pole. It's the individual demand planners who are deciding on whether to follow our forecast and replenishment supermarket shelves. And they don't have a lot of power, and sometimes the only power these people have is to say, yes, we accept the forecast, and no, we do something else. And so it's exactly the same problem, but it's somewhere completely different.
And they might want to make that little minor tinker so they feel like they had an influence.
Exactly. So they can go home and say something. I made a difference today. We ordered 2 cases instead of 3. It's something to keep in the back of our heads when we're talking about that. But
yeah, and I like to remember that it's not just public sector, but private sector, and any kind of situation when you're in an organization and you're trying to get acceptability around a forecast. So was there?
Yeah, I just wanted to offer
yeah.
that too. Is yes, we do kind of at the top at the council. We have the big wigs. We really try to, by the time it gets to them, we almost want them to fall asleep in the meeting. We want it to be boring. We want all the conflict was done down at the bottom, and by the time it got up to them, they're just getting a report out.
yeah, managing the managers.
Yep.
Yeah. So here we have a black swan, and this was when I was in Hawaii, and I was thinking about this was. Anyway, it's like, oh, there's my black swan. So I had to just definitely get a good picture of that. I knew there was a reason why that black swan swam by. So we're going to look at the forecasting challenge from COVID in terms of process and a product standpoint. So it's not just a black swan in my thinking about it. It's a black swan treading water through a perfect storm. So the black swan to me is we're projecting a baseline forecast, and the challenge is due to the lack of relevant historical data, which I think we can all relate to. The perfect storm comes when, because of the pandemic, the legislature and agencies needed to enact policies to mitigate the effects of the pandemic. So you've already got like your baseline forecast is kind of really tough to do, and then you have more and more of these new product forecasts, if you will, or policy changes brought into play. So it's sort of, like I said, like a black swan treading water through a perfect storm. And again, at a time when we talk a lot about AI, this is really a point when judgment and domain knowledge really become increasingly important in these types of conditions. So, okay, well, what happened in state government and state services? Primarily, so when I make a generalization, we always know there's an exception to the rule, and we're covering a lot of different programs. So this is really a simplified summary. But what we saw was primarily a reduction or suppression of both supply and demand for state services. So some examples. Public schools went virtual. So some parents opted to homeschool or transfer their children to private schools. Supply and demand for childcare services dropped because most children remained at home and the centers were closing. So supply and demand suppression. Nursing homes, as we know, got hit very hard by COVID-related deaths and fewer entries due to lockdowns. And if folks recall, the first identified case of COVID actually hit a nursing home in Washington State, so very close to my hometown in Olympia. So that hit us hard, hit everyone hard. Prison populations dropped due to lockdowns, some early releases, fewer arrests, and less courtroom activity. So this just gives you sort of a paintbrush example of the way that the supply and demand were suppressed in most caseloads. And I actually have some graphs. I don't have equations, but I do have some graphs to show what happened. It's coming. Now there's a major exception to this, and that's the Medicaid medical assistance caseload. It increased substantially due to the requirements of the public health emergency. And the public health emergency was mandated by the federal government. It just happened to be dropped in May, but through this whole several years, the public health emergency was renewed and renewed and renewed, but we never knew if it would be renewed. So we had to keep watching, what was going to happen with that federal policy. And the impact of the federal policy is that substantial requirements for eligibility reviews were suspended, and so terminations from the caseload were very, very few. So your model had entries growing and hardly any exits, basically. So there's my next slide. So here's what it looks like. March of 2020, the start of the pandemic lockdown in Washington State. Here's what's happened since. This is an increase of 500,000 clients, or 28%, from March 2020 to March 2023. So the next time I want to come back with a story of what's happened now that the public health emergency is lifted, but that just happened. So what the challenge now is going to be for the agency to do all those eligibility reviews in a timely fashion, and it's going to be really a challenge. And our forecasting challenge is going to be to see how that goes. So that's the exception to the rule, because I mentioned that most caseloads had a suppression of supply and demand, but medical assistance, very much the opposite. So this is more the typical kind of trend that we saw. And this is the adult inmate population. And so from March 2020 to March 2023, the caseload dropped by 4,000 cases, or 23%. You are seeing a little bit of what might be a beginning to a return, but clearly not a return to normal, right? We're going to be at a very new normal. Nursing homes, I will give you a slide later about the forecast so you can actually see not just the actuals, but the forecast. So this is what the caseload looks like starting the March 2020, and we see some dips and a little bit of a resurgence and dip, a little bit of a resurgence. These tend to follow the pattern of the Delta and Omicron waves, not exactly, but close. And so right here is the beginning of the pandemic, obviously, and so that's the biggest drop we had. And then this was December of 2020, when not only did you have the pandemic at a height, but you had, cold weather, and you had, typically nursing homes someone can have a hip injury from a fall and that kind of thing. So you had a really big drop in December, and then you have the Delta and Omicron waves, and a drop of 18%. So that's just 3 examples. We've got a lot more. And by the way, we're thinking of it, our data are publicly available on our website, and I have a link to our website at the end. So let's start talking about our ABCs. Forecast acceptability in black swan times. So we relied heavily on our technical work group process. We utilized the formal work group when consensus was difficult to obtain at the technical work group level. And I'm going to give you an example of that. And that is this idea of a return to normal. Looking back, we thought first, this might just be a couple months. Okay, now maybe it's going to be a few more months. Now maybe it's going to be a few more months. So we had this idea of, again, a return to a normal, then a new normal. And, we just kept thinking there'd be a turning point. And so we had to keep putting out that projection of when that turning point was going to occur. And so one example is that we used July of 2021 as our return to a new normal. And the way we did that is that at the technical work group level, it's really hard for them to say, I don't know, what number are we going to grab? What month are we going to grab? So what we did is we worked with the formal work group, again, the higher level, senior level staff, to say, well, we don't know, but we're talking to people who have a more global understanding of all the programs and like which program could we peg a July 2021 date to. And so we were able to say, to the technical workgroup members, we could say at the formal workgroup level, we agreed to this July 2021 return to normal date. That also happened to correspond at the time with our governor's roadmap to recovery, and in many cases that July 2021 date was used. So anyway, that's just an example of like when you're just grasping for straws, that's how we were able to use that formal workgroup process. We also created a streamlined framework for communicating high uncertainty across all forecast areas. And I'm just going to give you a template to give you a sense of what it looks like, because as my colleagues know, the simplified streamlined framework is still pretty complicated looking if you don't know all the programs. So what we had on the horizontal axis is we tried to say, what are our major risks and by what group, okay? And then we had our general caseload area, so our 6 program areas, and then underneath those are another, like, say, 4 or 5, 6. So like 30 forecasts in the program area. How can we categorize the risks and put these all into one page, because we know that decision makers like to have one page to hold on to and try to feel like you can grasp all the uncertainty in one place. So we had federal policies, and we projected the direction of risk and assumed policy end date. The same thing with state policies. We had to look at the economic downturn. And then, of course, there are so many nuances and so many different programs that we just had an other category. And we tried to gauge that in terms of a high, medium, or low risk. And there's a lot of subjectivity here, but it was our attempt to get to something that decision makers could understand, again, to get back to that acceptability. So bias identification in black swan times. Okay, I mentioned that we were over-optimistic in our return to the new normal. I already mentioned about the July 2021 date and how we had to keep moving that as like the Delta wave hit and the Omicron wave hit. So in hindsight, we were optimistic. And that's just going back to the ABCs and just recognizing our bias. Yes?
Quick question, when you came up with that July 2021 date, was that before July 2021 where you said, well, this is the date where it's going to normalize, or was that after July 2021 where you're like, well, this is where the data has normalized?
Oh, no, it's well in advance of July 2021.
Thank you.
Yeah, definitely. In fact, I have to go back to look at our notes, but I want to say maybe as far back as the November 20 forecast, I think we had to come up with something. So several months back.
We knew the vaccines were coming.
So, yes.
Right around then.
Yep, that's true. Yeah, we did have more than just grasping for a random date. That's a good point. I will mention that most of our forecasts still outperformed the naive model. We do annual performance measures, and we do submit those to the governor's office, so they're publicly available. And while we still outperform the naive model, of course our accuracy wasn't as great, right? It was kind of sort of crazy times. So now let's just tell a story of what this looks like, both in terms of just understanding what our forecasts look like, but also this concept of identifying our unintended bias. These first 2 lines are before the pandemic. And it happened to be that February 2020 was our last forecast for the legislative budget, and then March 2020 happened. So that was a lot of fun. And so then what I'm showing you is just the February forecasts, even though we have a November and a June forecast that would make too messy of a graph. So just trying to keep it sort of simple. And you can see how we're trying to project these turning points. And so we're saying, well, okay, we're going to try to return to like some sort of new normal. You see, we're trying to get back up to that level we thought we were. That's our February of 2021 forecast. And then this is, so I get that right? Yeah. So then we've got this big dip here, and that's, I believe like the Delta wave-ish, I think. Yeah, 2021 was Delta and then Omicron. And so then we see, okay, a little bit of resurgence here, and then we're optimistic that we're still going to get up to some sort of new normal. And then we had more impact of the pandemic, and the good news, I'll say, where we're at now is why I think we're starting to weather the storm, is that our February forecast is actually tracking pretty well. I just looked at the accuracy of the February forecast, and it's within 1%. That's pretty good. And our June forecast is not on here because I didn't want to add more complexity. And our June forecast is showing stability, and it hasn't changed much. So I'm sort of hoping that we are getting through the storm, but I also don't want to jinx us. Okay, so as I mentioned, accuracy has improved across the board for the most part over the last couple forecast cycles, November 22 and February 2023. And as I mentioned, the June 2023 forecast update is seeming to stabilize in most areas for 3 reasons. Our actuals are coming back to a stabilized place. It's, again, a new normal, but at least the data aren't, continuing to tank. So we've got a little more historical data from which to base our baseline forecasts, and so that's good news. And then we did either drop or dampen our return to new normal assumptions, because we're just recognizing that it's just not going to happen anytime soon that those caseloads are going to go back up to anywhere near they were before. Again, with the exception of Medicaid. And we have fewer legislative policy changes in response to the pandemic, so we have fewer new product forecasts to try to project, if you will. Okay, so this is something that I want to hear from you folks. I think, we have a little extra time today because there's 4 sessions, so we could go as late as like 12:30, but I don't think people want to. But we do have time to chat as much as people would like to. So, we went in March 16th for us. We went from, standing around the water cooler to like, okay, everybody go home, figure it out. Figure Zoom, figure WebEx, figure Microsoft Teams, figure out how to blur your screen, figure out what to do with your kids and your dog and the UPS driver that the dog likes to bark at. I mean, we just went through some major change in just such a short time period. So there were challenges to this and there were benefits. And in thinking about this, so it's much more convenient to meet virtually. There's benefits and challenges to that. Because I found myself, I can attend 2 meetings at once now. So I'm going to have my one screen here, and then I'm going to turn on my iPhone over here, and I'm going to pretend that I'm in 2 meetings at once. And I think there's research about multitasking, and there's really limits to that in terms of, but what we think we can do. I can be in 2 to 3 meetings at once, and this is the case as deputy director. I'm just sort of listening in to make sure that nothing like political or controversial, bubbles to the level where I need to weigh in. So, but still, that's not the best thing to do. But I found myself, in 2 meetings, then I'm like, I think I can go lift some dumbbells over here if I turn my, video off and mute, and so, and I can, let my dog out and all that kind of stuff. And anyway, so there's just a lot of things involving multitasking. The ability to go to more meetings has its advantages and disadvantages. We can get overwhelmed. And I want to make a point about the challenges of facilitating a meeting. Our forecast work groups are typically anywhere from like 10 to 25 people. So that's a lot to navigate in person in and of itself. But when you're in person, you're able to look at the facial expressions of your members, and you can see if they're furrowing their brow or if they're looking down or if they're scowling at someone else, and you can kind of navigate that in person. What happens when you're in a meeting where those people are little circles with their initials? And when you're used to maybe having a vibrant debate in person and you have people raising their virtual hand. And so there are advantages and disadvantages. And I would say, one thing about an advantage would be when people are raising their hand, it's like a more structural, virtually raising their hand, you have like a more structured way of having the conversation. But you also don't get that sort of organic back and forth. And then sometimes you just don't know if the people are still in the meeting. So there are a lot of interesting things that we learned in this time.
I've got a question.
You bet.
So a good thing about that virtual meeting is that a lot of times people will check out and then default to alternate back channel ways to come to consensus. Whereas if we're all here, we're looking at each other eye to eye and we all agree, great. But if I'm Elaine doesn't know what she's talking about, I flip off my screen, I can have a side conversation with other people. So did you see any of that?
No, because that's a really good question. But no, because they need to be listening because we ultimately own the forecast. If they leave the room and they don't put their say in this particular institution, organization, we go on anyway. If ultimately the forecaster gets the final say. But we want to avoid that conflict. We don't want to say, sorry you weren't there, we just went on without you, but looked like you were there, or that's something that our institution and organization is built to defend against, and that we are the ultimate owner of the forecast. But again, in doing so, we really do want consensus and acceptability. So I would just say that 25 years of institutional development in this collaborative forecasting process that has allowed for trust and transparency. We didn't just switch the gear into virtual and like this new work group. The work group had been in existence for 25 years. So I think that made us, transition to the virtual meeting space more seamless. Not seamlessly, but in a easier, incremental way. Yeah.
Elaine, there's a question over here.
Oh yeah.
Well, only if it doesn't disturb your talk. Could you just go back a couple of slides to your nursing?
You bet.
graph, where you've got 2 or 3. So back in where are we? June 20, or even earlier than that in your February forecast. To what extent do you offer your stakeholders a number of different scenarios and the forecast based on those? Because you've got one projection there, and I'm thinking February 20. Certainly in Europe, we were starting to see a few breakouts of COVID, so it wasn't just a sort of Southeast Asia thing. It was starting to spread globally, and we were very uncertain about what might happen. And people were worried about, well, if it takes this trajectory, then what's that going to mean? Or if it's less severe, what's that going to mean? That sort of thing. How did that play out for yourself and in terms of the options?
Yeah, so two layers to your question. One is how we do provide, in cases where, as a statistician, there's not always one perfect baseline forecast. So a lot of times we'll say, well, it could actually be a little higher or a little lower. And so sometimes we'll present maybe 3 recommended forecasts that we let the work group weigh in on and come to a conclusion. And many times it's the case that, say we just give 2 options, guess what we're going to do? We're going to pick the middle. We're going to do a combination of the forecasts. That happens a lot. In the case of the February 2020 forecast, I think we were pretty much thinking we don't have enough data yet about the impact of COVID, so we really did not incorporate that.
And wouldn't most of the work for the February 20 forecast would have been done in the second half of January?
Yeah, that's a good point. A really good point. I didn't bring up the fact that our administrative data are often lagged, and our nursing homes data are based on claims, and they're lagged by I think 3 to 6 months. So we were working with data that probably November data, yeah. And it depends on the program. We have some programs where the data don't need to be, by lag adjustment I mean that the data are incomplete and we need to come up with another forecast about what the actual data will look like when they are complete. And nursing homes is a case where that process is more extended, and so we have to cut off more actuals.
Yeah, they're developed the February forecast is developed, and then the technical work groups happen in January,
right.
And then the council meeting happens in February.
Yeah.
The final approval,
Early.
That's why February is the name for it, but most of the work is earlier.
Okay, thanks.
Yeah, and I don't think we were all that worried at that point.
I wasn't.
I wasn't.
I think when we present multiple options, that's one of the areas that bias comes in. It's not as much the forecaster's bias. Well, that happens also, but the consequences of forecasting low and high, it's not a symmetrical risk in terms of what happens in the real budget and political world. And so if you have some number of options which are to varying degrees defensible, you have to know where the drift is likely to go within the work group process towards something where we can deal with having a surplus, and if we have to go and cut other programs and tell the chair of the committee that they've got to cut things to fix the problem, then it's a different situation. So that impacts that dynamic.
Okay, thanks.
Yeah, thanks for that. Really good question. So going back to just another part of collaboration and communication is just to emphasize that we do have this institution of the technical work group and the formal work group, and how that really, allowed us to explore and exchange domain knowledge in areas where we just had to ask more questions than we normally would, rely upon our statistical models a lot less. So having that trusted environment was of the utmost importance during these times. So the slide you saw in the beginning, how did we deal with acceptability? We tried to create a streamlined, simple kind of one-pager for our council, and simplicity, again, is the ultimate sophistication. You saw our optimism bias, unintended, towards a new normal. And we talked about the importance of domain knowledge when statistical models fail, and the impacts of the remote workplace on the forecast process. And so this is a lot here, but I just told you about what a fan I am of one-pagers. So this is really just putting everything onto one page for you, where you have the original world of our ABCs, and then you have our revised world of the ABCs. So you've got my analysis of what things looked like in 2005, and then my analysis of how we are weathering the storm of the pandemic in 2023. So next steps, this sounds ambitious a bit, but it's always good to think about what we want to be doing next if we have time. I'd like to do a more in-depth analysis of our forecast performance since the beginning of the pandemic. I mentioned that we have annual performance measures, but we produce forecasts 3 times a year. I'd like to take a look at those, and not just for our performance measures, we have a select few, but we have a lot more forecasts. So I'd like to dive in and look at, what's, say, 50 forecasts instead of maybe just the 10 that we report, because we're looking at more forecast cycles and just play around with the data and see what we find. And again, compare those forecasts against the naive model, and then take a look at those step adjustments for COVID-related policy changes, what we thought then and what we see in the actual data. I think there's a lot of area for research and investigation. So that's your sort of quantitative side of next steps, and this is your more qualitative side of next steps. We have about 180 technical workgroup members. I'd like to put together a survey and ask them, what do you think worked best? What didn't work? What can we improve in terms of this new virtual technical workgroup process in the remote work environment? Because we're still working remotely, and so far, most of our technical workgroup members, we poll them and say, hey, do you want a hybrid? Do you want to stay remote? And so far, most people are like, we just want to stay remote. So then if that's the case, what does that look like in the future? So I'd like to do a poll to find out our stakeholders, our technical work group members, find out what they think we can do better and improve upon, and what should we do moving forward. So that's sort of your qualitative side of things. Now I would like to hear from you if anyone wants to chat about, or if you want to line up for lunch, if anyone wants to chat about how COVID-19 impacted your organization. What stories do you want to share with the IAF community? This is a great place to do that. And as Foresight speaker, consider submitting an article for Foresight. And I'm also the government and public policy editor, as Mike mentioned. But this is not limited to government and public policy. As you know, this affects all areas. So does anyone want to talk about their experiences, or putting people on the spot, or thoughts or questions?
Stefan, do you have any articles you want to submit to Foresight? Keep up your streak of like 3 articles per issue lately.
Actually, none of those.
Better rename it Foresight.
But I can start pontificating. That's one of those things I do very well. So I do retail forecasting. In case anybody here doesn't know me, and I'm at SAP. So we provide the software, and then the retailers run the forecasting, either on premise or in the cloud or what have you. No matter. And of course, retail had a major COVID impact in all kinds of ways, and everybody knows about that. So it started out with people trying to bundle their purchasing so they wouldn't go to 5 supermarkets to get something here and something there. They'd rather go to 1 or 2 supermarkets to minimize their exposure to potential carriers of pathogens or what have you. So that was one impact. Then there were the differential impacts on different products, which I still think are mainly driven by social media and just the hype and the craze that happened. Toilet paper, I have wonderful pictures of empty toilet paper shelves from my supermarket back home. Flour, oil, all kinds of staples were majorly impacted. And of course, our customers, so the retailers, they were kind of rotating at high speed to figure out what's happening here. And all kinds of fun things happened. Like right at the beginning of the lockdown, one of our customers, a Swiss retailer, had a promotion on olive oil. Switzerland is horrendously expensive. Olive oil in Switzerland is horrendously expensive. but it's reasonably shelf stable. And everybody at the beginning of the lockdowns was wondering, is the world going to come to an end? We'll never be able to buy more olive oil. So, and there was this promotion right at the beginning of the lockdown with a massive price reduction. And so this promotion, I think people stormed the stores, and there may have been scenes of physical mayhem. I don't know. So sales went through the roof, and to this day, I don't know what happened the next time they had a promotion on this particular item and how they dealt with the forecast then, because what's going to happen is everybody's still stocked up with olive oil and they'll have their own whole garage full of olive oil. Nobody wants to buy anything because there's only so many salads you can eat. Or did they continue? I have no idea whatsoever. So there's, again, as you said, there was a lot of uncertainty that needed to be communicated in some way to stakeholders, and stakeholders here were the people that were responsible for the supply chain. There was a lot of probably communication going on within our customers, and it was a very, very, very hard time. Our customers went through that reasonably well. One thing that they had to think about is where are there actual step changes in people's behavior, where the post-COVID behavior changes from the pre-COVID behavior. Hand sanitizers and face masks. We're still buying more of those than we ever did before the pandemic, even though it's renormalized a bit. Other things, demand went back to normal. Other things, demand went below normal. And all of these you could model by including appropriate predictors in our causal models. Because in retail you have so many thousands, tens of thousands of SKUs. You can't do it manually anymore. You have to do a lot of automation here. And the question really is, which predictors do we roll out across which part of the product hierarchy? And so there was a huge amount of manual intervention and judgmental, not adjustment of forecasts, but judgmental model building in here and feature engineering. So, and I think, and of course, everybody, as you said, still working from home, both at our customers and at our places, and we have the exact same issues that you mentioned, juggling children and pets and the ambient craziness and trying to get all of this. So I feel your pain, and I'm feeling the same pain. I don't know what really is the point that I'm trying to get to, but I hope I gave everybody an opportunity to think about what you want to share.
Thank you.
There you go.
I'm formulating my conversation. But I think your charts really showed an interesting forecasting challenge, because first is everyone was trying to forecast the bottom. When are we going to bottom up?
Yeah.
And then the second one you showed was trying to, I think, forecast what the recovery would look like. There was a lot of argument about a V-shaped recovery versus a U-shaped recovery. And then, the challenge that I came into with my clients is, okay, have you changed customer behavior? So my main client is a CPG manufacturer that has a longer than 28-day lead time, Stefan. Just wanted to put that out there. But we saw a switch in consumer behavior because people weren't eating out anymore, right? And so their sister company that was in the commercial, they tanked. But this company went up because all of a sudden no one's eating out and everyone is back. Well, I'm going to pick this up, and run back home, right? And the question is, as we come out of that, how is that changing? Is it a new normal where I'm going to make a lot more of my stuff, or am I going to start to go out? Am I going to start to go to hotels and conferences where the commercial retail is going to come back to a new normal? The retail that's in the grocery stores. So that was a challenge for my clients. In the first several months, it was just like we're trying to stay afloat, right? I was able to duck and dodge what are we going to do about our stat forecast, because now we've got all this bad information in the past. I think I've pushed that off enough where I'm like, okay, well, we've got better data now, we can start to reforecast. But that whole COVID information was like, I have no idea what to do with that information other than survive it.
I'll expand on that. I am absolutely the worst forecaster in the room by far. I'm only here because I graduated from Darden like 30 days ago.
Congratulations.
But this kind of work has been fascinating. So my most recent post is a CDO at Pizza Hut US, Yum Brands, and what you're talking about is like what we're trying to find out in the restaurant space, not necessarily the consumer-driven side of the food piece, but like how are we going to build assets moving forward?
like our boxes, right? So we're trying to like consumer behaviors change so much in the way that like we're now entertaining the idea that we're going to shrink our boxes almost 50% of square footage because people are not going to sit in dining rooms anymore. Chick-fil-A is running into this big time because like their operator said, no one's sitting in my dining room. I'm not going to build an extra 1,000 square feet. Why am I going to do this? So we're trying to think like through the lens of like, how do we forecast our assets and the size of them and like our capital outlays now based on like post-COVID behaviors. And then on top of that, we had this explosion of virtual brands because no one wanted to eat out. And so you have all these known brands that you think of, today that operate these virtual brands underneath their umbrella. And so we're building restaurants in the back of warehouses now and serving the same products under different brand names simply because people don't want to sit in a dining room. And how's that going to impact the way that we sell franchises? Or if you're publicly traded, like how are you forecasting that into like your earnings statements and things like that? So it's really like messed up the way that we traditionally thought about restaurant retail development and how it's going to impact us moving forward from an asset perspective, like the boxes we're building and how we actually bring those products to life to the consumers. So it is a very shaky ground right now with a lot of different opinions.
Yeah, and we also have the issue of the workspace as the state of Washington determines, we work together to figure out who's working from home, who's hybrid, and what level. So the state is working through like space constraints or not constraints and issues.
If he wanted to respond to that, I want to change topics.
I just want to say it's sort of like now we're moving into the phase where we're trying to forecast what was a sea change and what wasn't.
Yeah.
And in restaurants and movie theaters, I think it's extreme. And in some things they're like, oh yeah, we are back to normal.
Perhaps I can add one topic to that one. I'll be short, I'll be brief, I promise. One book that I reviewed for Foresight, I think was called Resurrecting Retail, made a very interesting point about that with a trend towards more working from home, which probably everybody around here is doing. There is a differential impact on restaurants and so on and so forth, and all the establishments are along the commuting corridors.
Yeah.
If you're a coffee shop at a restaurant station at the highway or at a train station or something, you're majorly impacted by fewer people commuting because everyone's working from home. And so there's going to be major problems here because there's no going back to normal. There's a step change in how many people work from home. And yes, that is renormalizing to earlier levels, but no way as far as it is. And of course, especially in retail where people are operating on razor thin margins, there's going to be a bloodbath, or it's already happened. And the question is, what's going to happen to all that real estate that suddenly nobody wants anymore?
Yeah, no, it's fascinating.
Yeah, so I do resonate with all the new normal, but I wanted to go back to the discussions of risks because that actually really resonated with me as well, that we had to start enumerating like what risks could we account for and what risks couldn't we. So I have two questions on this. The first one is forecast ahead 5 years. Let's say everything stays normal. There's no black swan for the first 5 years. Will you still produce that risk one sheet?
No, we stopped producing that one pager.
We're still producing ours. We're just not showing it to anyone anymore because nobody asked for it anymore.
This was actually the first time I heard of it because I came on a year ago.
Yeah, so
I was like, should I be doing that risk sheet?
Yeah, so there was one point where a couple things happened. The risks were starting to diminish at the same time they became so diverse that we really couldn't put them on the one pager anymore. And we almost felt like the one pager became false precision in terms of our ability to encapsulate it in one page.
But, though I'm assuming you still have like, this is our forecast, but there is, say, upside and downside risk are equal, but the downside is going to is less, like might be a 2% versus 5% upside. Like if upside happens, it's likely to diverge more than the downside. Like you guys probably have an idea of that, which is going to go to my second question. I'm going somewhere with this. I know you're like, in person you can see more. I do, right? Yeah. So you're producing your forecast for one customer, the purposes of budgeting and the government, but you're publishing them, which means I'm sure lots of people are using them for other purposes, like nursing home supply companies might be using your forecast to say how many whatevers do we need to have in stock. If they contact you because their risks may not be the same as, say, the budget office risks. Like the budget office may be like, our cost of over forecast is much bigger than under forecast, but the nursing home supply company might be reversed. Do they ever have that conversation with you? Because we're having that right now. We've got different customers with very different risk profiles.
I think that there are stakeholders that would communicate risks to the people in the work group. It's more of like an indirect thing. Like I don't get, we work just with the work group members. So say the agency CFO is maybe going to hear about this, or the program manager for a particular adult family home kind of thing, you know. So that's gonna get funneled up to the program experts at the technical work group level and the budget experts. So we don't really interact with that level of discussion.
We in fact try not to. It's if a stakeholder that isn't one of our work group members, a technician, wants to communicate with us, that'll just probably be Elaine and I. And this is to try to keep the politics out, you know. The people at the table should be, to the best as we can, the technicians or the people running the programs only.
Okay, and those are both giving you the information you need for forecast, as well as then communicating out what the risks were baked into that forecast.
Sure.
Yeah, you're lucky that way.
Yeah.
Now, the one-pagers did, but we did and continue to identify in a qualitative manner risks to forecast and kind of the standard published summary of them. And so the less, like you were saying, like how the risks have become more diverse and specific to each forecast to some degree. So
Yeah,
that's not quantified.
we do a two-page summary for each high-level forecast, and at the end of each summary, we say what the risks to the forecasts are. So then our council gets a booklet of narratives, and they can get into more detail than just a one-pager. Like, it's actually 56 pages. So.
I was going to add, the risks and opportunities is interesting because pre-pandemic, you know, so my interest is sales and operations planning, putting that into companies, and I'm always saying you've got to understand your R&Os that impacts your profit and loss. Pre-pandemic, no one cares about R&Os. During the pandemic, hey, all of a sudden we're really, really interested in risk. And what I heard you say may be a little bit sad, because like now that the pandemic's over and we're back to kind of this new normal, is the focus on risk and opportunity somewhat diminishing because we're going back to that's probably not going to happen, that's probably not going to happen. So I try very hard to make sure that R&Os are always discussed because it translates to profit and loss, upside, downside, and what you can do to mitigate those risks. But you're still doing that. You just said you haven't condensed it to a one-pager, correct?
Exactly, and we still talk about risks at the technical work group level, and we're not in that situation where we're trying to come up with like more universal assumptions of risk. Now we're just, each forecast is going its own way now, kind of thing. So those risks are articulated in those narratives, and then discussed in detail at the work group level.
Off of that too, you know, a big risk we hear a lot is, isn't there a recession coming? And recessions have huge impacts on our caseloads. Generally will increase demand for the programs. And that raises then the next, like a forecaster would think, yeah, it's just like a straight forecaster, we should probably do something with that. That's pretty uncomfortable for us because we have this Economic and Revenue Forecast Council, which is a completely different agency, and they're tasked with predicting economic indicators. So for us to start trying to do anything that diverges from what they're saying would break the consensus on their side of it. So we do struggle sometimes with being able to bring in kind of known big risks that might be on the horizon.
Yeah, and a lot of times they release their forecast right about the same time that we're releasing our forecast too, you know, so yeah.
All right. I think that we
Ready for
guess we
lunch?
can sneak over and be first in line.
Yeah, there we
at
go.
Lunch now. So, hey, thank you, everyone.
Thank you so much.
Thank you, Elaine.
Thank you all for your interesting feedback, I love it.
I was just going to say, you were talking about releasing, I can see those risks on that one. We didn't go that. Oh, we had an
So-
Yeah,
We're
yeah,
down.
it's-
It was
it's-
more of
Yeah,
like,
because
you
I'm
could
the
normally
only
say, and if,
You know,
if
looking at
there's
that
another
time
way of like
series,
there's a downward risk, and that downward risk is bigger than the upside risk of people
Yeah.
continuing.
Yeah, and there was a whole lot of
Yeah.
there's a whole lot of nuances to that.
But it was
Yeah,
just
exactly.
They get into unless I'm the forecast expert, you know, but a lot of like the governor had to make some
like they're both equally
decisions
likely.
about
Just
early
one's
releases
likely
and things
to
like
be
that
bad.
because they're like, well,
Because I mean,
you know, how do you
forecasting
socially distance?
Oh,
in that,
okay.
in that example.
Yeah.
So how often people are driving
Your people that your
Your
people.
report ban,
People started driving worse
people
too.
actually breaking
Faster.
in.
Yeah,
because all
and-
the
and
Yeah,
houses
I got
aren't
my car
And
declared.
there's
totaled by this
fewer
kid.
arrests because people aren't.
So
Driving.
And then it was like, well,
Actually,
then there's the
driven
hidden
by
domestic
totally
violence
different
crimes that we
Yeah.
wouldn't see
Yeah.
because
So
of that probably
during
increase.
COVID, there were less
definitely.
cars on the road. So
Yeah, lots of
people drove
nuances.
faster.
Yeah.
Thanks so much for your
No,
feedback.
that's-
Subsidiary in terms of damage to the vehicle. Second,
From my perspective.
replacement part costs
Yeah.
That's my
way up.
Oh, yeah.
But there's a lot of good that we
The
can do.
value of the cars also went up, but at different rates for different cars.
Yeah.
So in totally needs the
Right, right.
Because they've got
So
similar
we had a
hardware
lot of fun with because we
that
don't
donors
have
that have, you know,
we forecast auto claims.
somebody who's
Also
got
trying to say
vested
like
interest in
how
it,
many
a
of
lot
them have to go to the
pride,
special
I'm giving
group
you
that deals with
$1 billion.
total
What are you gonna
losses.
do with it?
Yeah.
I wanna see you spend it.
We were like,
Yeah, yeah.
do we have to
You know,
start
how do you-
trying
how
to
do you
incorporate
manage
blue
some of
book
that
value
stuff?
or reflect?
So that's why it's awesome.
And
valuable
repair
framework.
rates, and we
You've
were
got a
like,
framework
no,
you can
no.
apply
We're
really
like,
quickly.
That's right now, we might
Extremely valuable for people.
feel like we can't.
And there was a lady I was talking to last
Yeah.
night who's here.
Too fast, 'cause we're
I
doing
was
it
surprised she
static.
wasn't, but she works.
Because
Right.
if we don't know 6 months
GL.
ahead,
Was a
it's
decade
irrelevant because you
listening
can't
to
hire.
stuff.
Well, I think there were
Right,
a lot of really good other presentations going on right now. I
Yeah.
saw like some stuff that I'm like, I want to go to that. What do I have to?
Yeah.
Well,
But I'm
in
glad.
those presentations, I just raised my hand like, well, we're gonna override your forecast anyhow, so what are you doing? I have not said why.
Actually, Bachmann, you know Bachmann Rosani Tabar? He does a lot of forecasting for social good. He's the guy who does the workshops in developing countries, and he does a lot of
Oh, yeah.
forecasting essentially for the national health service in England. And so he's very, very much into this general.
Can I help people generate a good forecast?
Yeah, yeah.
I know I have a much better appreciation for your for retail.
Yeah,
So I'm coming from, you know, your suppliers.
yeah,
Who
exactly.
are,
so you're the not the enemy.
Man,
but-
not the enemy. We're no.
Yeah.
People want to make retail happen. That's the challenge. Is because
Oh, I'm
you
glad
get
you enjoyed that. I'm glad you showed up. It's it's not
lead times.
you know this kind of process stuff isn't talked about as much, and I wish it was more in.
Natural variability. And that's the biggest challenge at Walmart. Like I can't apply that. We're locking 6 weeks out, and then we've got to figure out how to get it to a DC. Like
Yeah, well, Walmart still I'm always harping on it. Walmart is so special in that they don't have any promotions. And if you have promotions, then that adds all kinds of variability and what have you. Your promotion only runs at one retailer, versus it runs everywhere. How far ahead do you know? It's negotiated. Negotiate.
Very slightly, very slowly, just sort of accelerated that. And now the challenge is now trying to get people back in the audience. A couple of years, and depending on the personality type, if you've enjoyed working in that style, so the big challenge is what are we going to do in real estate?
Right, and and I didn't want to get too much into detail on that, but that's happening with the state of Washington, and we're all pretty much introverts. And I've got one of my colleagues who'd rather just be surrounded by the 4 monitors, you know, than people, you know. And so far, I don't know what we're going to do. We have a whole floor of a building that's right across from the state capitol, and I don't know what's going to happen.
Yeah, I mean, we have some people who work in sort of specialist laboratories and
Yeah,
workshops.
so-
They haven't got a choice. They've got to be. And a lot of other people, particularly in the sort of the analysts, some of the engineers who do more sort of program management activity. There isn't a huge need for them to be there, other than to maybe overhear things and interact with their colleagues in that way, because sometimes that's a really, you know, it's a real big benefit of being in like an open office. You don't get any of those sort of interactions. That's good. But does that mean that they can do that, 1 to 2 days a week?
Yeah.
That's probably where we're topping out.
We're thinking, because why would I go into the office to be by myself? You know, so we're thinking like Tuesdays are when we normally have our staff meetings, and as people start to feel comfortable, maybe we can all come in on Tuesdays, I'd be pretty happy with that.
Mm.
Or even just like, I don't like having to drive to the office at 8 in the morning. Maybe I
Yeah.
come in from 10 to 2, you know. And our group has been just as productive, if not more, in this environment. But yeah, you do think about the benefits and the costs of the new world that we're in.
Absolutely.
Yeah.
Well, just so that you know, the UK have just started, I think last week, we are doing a big inquiry, a parliamentary-led inquiry into COVID.
Oh, okay.
And it's about national preparedness for it, also the responses, consequences, and all that sort of thing. But it's ongoing now. Years or something. It's all on the news.
Oh yeah. No, I'd be fascinated. I'd love to hear.
I think the health secretary's been, or the former health secretary, because he lost his job during the pandemic. He has been up in front of the inquiry today, giving his view.
Oh wow. Today?
Yeah.
No.
Giving his view of how prepared we were and some of the challenges.
Yeah, I mean, there's a lot to learn in hindsight because we don't want to have to go through this again, but at least we can kind of learn from what we experienced.
Yeah, but I mean, we would say there will be another one. It's just very difficult to try and predict.
What's going to be the next black swan?
Yeah, exactly. What the kind of impact is going to be, if anything, clinically, it's going to have to be more dangerous than the previous one because we've got over that.
Yeah.
So, really good.
Yeah, thanks a lot for attending and for your feedback.
Yeah, nice to meet you.
I knew I was going to leave my water bottle behind.
That's all.
Exactly. Nice to meet you. Hi, sorry.
How's it going?
That's really fun.
Yeah?
We basically, it's small, but we talked models the whole time and different exogenous features, how to bring in social listening, and then the potential to be really stressed.
Oh, yeah, that's okay. I'm good. I'm good.
When your voice goes up when you say you're good.
I'm good.
Yeah. This is great. Just respond.
Just trying to help. I've got Joe looking into it, but I'm trying to see if we can do the same for T3R. It seems like I haven't used the Twitter API in a while. I'm just trying to get set up with it again.
Do you want it?
I think the package I'm using was never updated for
The
this recent,
new pen
for the recent version.
yeah.
Because I guess the newer version, the V2 has a conversation ID, which is exactly what we're, so, basically what we want to do is